We all know the classic 8:00 a.m. clinic rush.
Oh, yeah, the morning sprint.
Right. You know you need to see your doctor, so you sit there, you watch the clock, wait for it to hit exactly 8:00, and you dial. And what happens?
You're immediately put on hold.
Exactly. You are immediately hit with this robotic voice telling you that you are caller number 14 in the queue. And then comes that seemingly endless loop of static-filled, elevator-style hold music.
It is the absolute worst.
It really is. All you are trying to do is reschedule a simple checkup, but suddenly your entire morning is derailed. It's frustrating, and it's an experience you have probably had more times than you can count. So welcome to today's deep dive. We are thrilled you're here with us because today we're looking at something that might just make that terrible hold music a relic of the past.
It's a universally painful friction point, isn't it? That feeling of your time just slipping away while you wait for the privilege of speaking to a human being at a medical clinic.
Waiting and waiting.
Right. But the intersection of healthcare and artificial intelligence is, it's fundamentally changing that patient experience. We are really standing on the edge of a massive operational shift in how the front lines of healthcare actually function.
I completely agree. And our mission today is to figure out exactly how AI is stepping into that healthcare front office. We're pulling all of our insights today from a highly detailed document outlining something called Cabot's Voice AI Agent Solution.
A fascinating system.
It really is. It's a system specifically designed to act as a medical receptionist. So we're going to look at what this technology actually is, how it navigates the incredibly complex world of medical administration, and most importantly, why you should care about this shift the very next time you need to call your doctor.
And, the timing for this technology couldn't be more critical. If you look at the landscape right now, the medical receptionist has traditionally been the absolute cornerstone of any healthcare practice.
They do everything.
They do. They are the gatekeepers, the triage directors, the schedulers. But that system is currently under immense strain. We are seeing a massive burnout epidemic in healthcare administration, rising operational costs across the board, and steadily increasing patient demands.
Just a pressure cooker.
Exactly. Practices are desperately seeking alternatives that are highly reliable and easily scalable just to keep your heads above water. And that is exactly the gap this technology is trying to fill.
Okay, let's unpack this. Because when we hear the phrase voice AI agent, it is really easy to just roll your eyes and picture a glorified answering machine.
Oh, the old phone trees.
Yes, the classic, infuriating, press 1 for billing, press 2 to be ignored, phone tree nightmare.
Which nobody likes.
Nobody. But according to our source material, Cabot's voice AI agent is entirely different. It relies on advanced artificial intelligence, natural language processing, and machine learning to handle complex, multi-step tasks dynamically. But I want to get past the buzzwords here. What does natural language processing, or NLP, actually mean when I'm calling my doctor's office?
What's fascinating here is how NLP completely changes the architecture of a phone call. Traditional phone trees are rule-based.
Okay.
They only listen for very specific keywords or keypad inputs to trigger a pre-recorded path. If you deviate at all, they break.
Right, it just repeats the menu.
Exactly. But natural language processing means the AI is actually parsing the intent behind your words in real time. It understands context, synonyms, and, most importantly, the messy way human beings actually speak.
So it's not just listening for the word appointment.
Precisely. Let's say a patient calls and says, I woke up with a really sharp pain in my lower right side and I need someone to look at it.
Very human way to say that.
Right. The AI doesn't just hear the word look and get confused. It parses the medical intent abdominal pain and recognizes the urgency based on how it's trained. It isn't a static menu, it's a dynamic interaction. And because Cabot's system is designed specifically for the healthcare sector, it is built from the ground up to understand medical nuance, not just generic customer service requests.
That makes a huge difference. Let's bring this right down to a real-world scenario for you, the listener. Let's talk about availability, which is the first major point in the source's at-a-glance comparison. Think about the traditional model. If you realize you need a doctor on a Sunday afternoon or at midnight on a Tuesday,
You're out of luck.
it's entirely out of luck until business hours resume. The traditional human receptionist is working about 40 hours a week. But Cabot's voice AI operates 168 hours a week.
Every single hour of the week.
Every hour. That is 24 hours a day, 7 days a week, 365 days a year.
If we connect this to the bigger picture, that 2047 availability completely redefines the boundaries of patient care. It shifts the power dynamic. Historically, the patient has always had to contort their schedule to fit the narrow administrative window of the clinic.
Which is so frustrating.
It is. If you work a night shift, calling your doctor at 10:00 a.m. is a massive burden. By utilizing an AI that never sleeps, the clinic services become available exactly when the patient actually needs them. It empowers the patient to take action the moment a health concern arises, rather than waiting for Monday morning.
Which perfectly brings us back to that Monday morning bottleneck we talked about earlier. The next metric in the sources comparison is simultaneous calls. And this is a huge one. A human receptionist, no matter how incredibly skilled they are, can only handle exactly one call at a time.
It's just a physical limitation.
Right. If four other people are calling in at that exact same moment, they're going straight to hold or to voicemail. But the source claims the AI agent can handle an unlimited number of simultaneous calls. How does that practically work?
It all comes down to cloud computing infrastructure. When you call a clinic using Cabot's solution, you aren't dialing into a single physical phone line sitting on a desk. You are connecting to a cloud-based server instance.
So it's essentially limitless.
Exactly. Because it's software, the moment a second or a 50th or a 500th call comes in, this system just spins up another instance of the AI instantly. This means there are zero hold times, even during peak morning rush hours.
So the queue is just entirely eliminated.
Entirely. And from a patient satisfaction standpoint, eliminating the queue is massive. Waiting on hold is consistently ranked as one of the most frustrating aspects of interacting with the healthcare system. Patients spend significantly less time waiting and more time actually navigating the care they need. They get prompt, accurate responses immediately.
Here's where it gets really interesting. Language support. The source highlights that human staff are naturally limited to their personal language knowledge. You might have a fantastic bilingual reception.
It's a huge asset.
A massive asset. But they are still limited to those two specific languages, which creates a massive barrier to entry for non-native speakers trying to navigate healthcare. Cabot's voice AI, on the other hand, is multilingual and features instant switching.
The language barrier is a critical issue in healthcare access. If a patient cannot clearly articulate their symptoms or understand scheduling instructions, the quality of care drops dramatically. Because the AI is built on massive large language models, it can converse fluently in dozens of languages.
And the switching is instant.
That's the key. If a patient starts speaking English, gets frustrated or confused, and switches back to their native Spanish or Mandarin mid-sentence, the AI seamlessly pivots and continues the conversation without missing a beat.
That is incredible. And honestly, the business math on this comparison is frankly staggering. The source estimates the annual cost of a traditional medical receptionist, factoring in salary, benefits, PTO, and payroll taxes, to be somewhere between $55,000 and $75,000.
Easily.
And that is for a single employee working 40 hours a week. But Cabot's voice AI operates on a subscription-based model.
It is a profound cost-saving measure for clinics. You are getting 204/7 unlimited concurrent call coverage without requiring additional shifts, overtime pay, or the massive hidden costs of recruiting and training new hires when turnover happens. But it isn't just about cutting the budget, it's about consistency.
Right. The source touches on that consistency. It points out that human performance is naturally variable. We are human beings. Our performance is influenced by our mood, by fatigue, by the fact that we might not have slept well.
We all have bad days.
Exactly. If a receptionist has just dealt with 3 incredibly difficult, angry callers in a row, the fourth caller is almost certainly going to hear a bit of exhaustion or stress in their voice. But the AI is described as flawless and always on brand.
Variable consistency is something every service-based business struggles with. But in healthcare, where patients are often calling because they're stressed, sick, or highly anxious, that initial interaction sets the psychological tone for their entire experience with the practice. The AI provides a baseline of unwavering professionalism. It doesn't get frustrated, doesn't rush the caller, and it always maintains a calm, helpful demeanor.
Okay, I hear that, but I have to play devil's advocate here. We are talking about healthcare. This isn't ordering a pizza or checking a bank balance.
Sure.
When you are sick or you're worried about a test result, you want a human touch. You want empathy. How can code possibly replace the warmth of human being? The source claims Cabot's solution is designed for personalized, human-like conversations and responds with empathy. But isn't AI empathy just an oxymoron?
It is a totally valid skepticism. And the developers at Cabot clearly recognize that sounding robotic or disengaged will completely ruin the patient experience.
Yeah.
The AI doesn't actually feel empathy, of course, but it is programmed to recognize the linguistic markers of distress, confusion, or concern, and to adjust its verbal responses accordingly.
So it actually changes its tone.
And it changes its tone, its pacing, and its vocabulary. Because it's tailored specifically for healthcare workflows, it isn't just spitting out generic customer service scripts. If a patient sounds anxious about an upcoming procedure, the AI is trained to use softer, reassuring language, perhaps slowing down slightly and confirming understanding more frequently. It engages in natural conversational dialogues designed to make the patient feel heard.
Okay, let's talk about the elephant in the room, security.
A huge topic.
The source is very keen to point out that this is secure, but let's be real. If I am talking to an AI about my health history, my date of birth, or my insurance policy, my immediate thought is hacker vulnerability. Isn't a digital voice agent a massive target compared to a paper file sitting in a filing cabinet? If I'm giving my private data to a machine, I need to know it isn't just floating out there in the ether.
Data privacy in healthcare is completely non-negotiable. And any clinic adopting this tech knows that a data breach is an existential threat to their practice. The source is very explicit here. Cabot's voice AI agent adheres strictly to HIPAA compliance standards.
Oh, what does that actually look like for a cloud-based AI, though?
It means the data pipeline is fortified at every single stage. First, there's robust encryption, both while the data is in transit, meaning during the actual phone call over the network, and while it's at rest on the servers. Second, HIPAA compliance for AI usually involves strict data redaction protocols.
Redaction.
Yes. The AI isn't holding on to audio recordings of your voice for developers to listen to later. It's extracting the necessary metadata like your preferred appointment time or your symptom keywords, securely passing that data into the clinic's isolated system, and then scrubbing the sensitive personal health information from its own short-term memory.
So they aren't using my private medical history to train their public AI models.
Absolutely not. The data environments are entirely siloed. Healthcare providers can trust that the information moving through the voice agent is handled with the highest level of security mandated by federal law. In many ways, an encrypted access log digital system is significantly more secure than a busy front desk where physical patient charts might be visible, or where a conversation can be overheard by a waiting room full of people.
That makes a lot of sense. Speaking of data moving around, let's look under the hood for a second. Anyone who has ever worked in an office, medical or otherwise, knows that the biggest nightmare with adopting new technology is getting it to play nice with the old computers.
It's always a headache.
Always. You buy the shiny new software, and it completely refuses to talk to the database you've been using since 2014.
System integration is historically the absolute greatest hurdle in healthcare IT. Medical practices rely on electronic health records, or EHRs. And historically, EHRs are notorious for being closed, highly protected ecosystems. Getting a new piece of software to talk to a legacy EHR system is often like trying to plug a modern USB drive into a 1980s typewriter.
But the source says Cabot's voice AI is designed for seamless integration. It works with existing practice management software, billing software, customer relationship management systems, and directly with those notoriously difficult EHRs. And they highlight a feature called real-time bidirectional sync. That sounds like IT jargon. What does that actually mean for the clinic?
Bidirectional sync is the magic bullet here. If a system is only one directional, the AI can read your file to see what appointments are open. But a human still has to manually type your new information into the system. But bidirectional sync means the AI actively reads from and writes to the database simultaneously.
Which completely removes manual data entry. The source makes a big point about human error here. With a traditional receptionist, they take the call, jot down the info on a sticky note or a temporary screen, and manually update your file later. And let's be real, manual entry is highly prone to mistakes. A typo in a date of birth, a misspelled last name, a wrong digit in an insurance ID number, those tiny errors can cause massive billing headaches down the line.
Exactly. With bidirectional sync, if you update your phone number or insurance info with the AI over the phone, your electronic health record is instantly and perfectly updated across the entire practice's platform. There is no middleman, there is no delay, and the margin for human error is drastically reduced.
And from what the document outlines, Cabot doesn't just hand you a login, wish you luck, and walk away. Their development team actually works directly with the practices to customize the AI. They can refine specific responses, add custom features, and make sure the integration fits the unique workflows of that specific clinic.
That adaptability is a necessity. The operational needs of a busy pediatric clinic are vastly different from a specialized orthopedic surgeon's office. The AI has to reflect the specific protocols and brand voice of the practice it represents.
Which naturally brings us to scalability. Say a local clinic gets incredibly popular and decides to open a second location across town. If they are relying purely on human staff, scaling up is a massive logistical headache.
You're starting from scratch, basically.
Right, you have to post job listings, conduct rounds of interviews, hire someone, and then spend weeks training them on your specific software and phone etiquette. By the time they are up to speed, you are already drowning in the increased call volume. But with Cabot's voice AI, the source states it scales instantly.
It effectively future-proofs the front desk. Whether a practice is a single-provider clinic or a sprawling healthcare network acquiring multiple new locations, the AI ensures consistent service. It handles the increased demand flawlessly and instantaneously without the growing pains and administrative friction traditionally associated with business expansion.
It is a lot of impressive tech to take in, but let's try to summarize the ultimate shift happening here. The source lists some core promises for practices that adopt this technology: improving patient engagement, reducing front desk burdens, increasing scheduling efficiency, boosting overall patient satisfaction, and driving operational growth.
This raises an important question, though. Whenever we talk about automation, AI, and efficiency, the immediate, somewhat fearful thought is, what happens to the human staff? Does the traditional medical receptionist just disappear into obsolescence?
That's the fear.
But if you look closely at the source's breakdown and the realities of modern healthcare, this is actually about crucial resource reallocation.
So what does this all mean?
We have mistakenly turned our most empathetic healthcare workers into glorified data entry clerks. By forcing human beings to sit there and act like human routing machines, answering the same basic questions about office hours 50 times a day, we burn them out. Voice AI isn't necessarily replacing the human, it is rescuing the role of the care coordinator from the burden of the keyboard. By automating the routine, repetitive chores, the basic scheduling, the simple follow-ups, the standard intake questions, the human staff is fundamentally freed up.
That is a phenomenal way to look at it. It means the technology is there